Good morning. My name is Dr. Stinger. I'll be your dentist for today. Okay, is this... Perfect. Can you confirm your date of birth, please? Good. I'm sorry for the lack of a nurse or assistant. We are still in the hiring process. More hoops to jump through when we're hiring professionals from all species. Lots of proofing things and preparing for adjustments per species basis. That aside, please lay down and relax. I'm almost done with the paperwork. Please do mind my larger frame. These rooms were not built with everyone in consideration. As I said, renovations. On the bright side, it does help me get into all sorts of angles. One of the benefits of having many legs, and many legs that can cling onto surfaces as well. Okay, looks like everything's in order. Pay insurance included. Thank you for your patience. First, let's check that blood pressure. Would you mind giving me your arm for a second? Thank you. How have you been? Any stressors or health concerns recently? No? That's good to hear. How's life been? Yep. Okay. Me? Well, it's been a lot of paperwork to go through, but I'm excited to finally work with patients. It's been too long. Okay, your blood pressure is looking good. Now let me put this on carefully. No, it's not a bib. Well, it sort of is. It helps keep everything clean. It's a sanitary thing. Okay, now open up for me. This is a numbing agent. It helps you not feel the needle. Okay, now close up. Just hold this against your cheek for a moment. Okay. Says you have a cavity that needs filling. Someone hasn't been flossing, haven't they? I know. It's annoying and you forget, and it makes your mouth bleed. But it's essential for oral hygiene. I'll give you a note to hang in your bathroom for it. After you floss for a few weeks in a row, you'll notice improvements. I promise. Well, you have my word, and multiple years of studying medicine to back that up. Alright, let's remove that, and... It says here you agreed to participate in my research. Oh, okay, just to reiterate and confirm your consent. You fully agree to me utilizing my venom as anesthetic for the following procedure. This is part of my research in the use of monster-produced paralyzing agents for medical usage. It comes in at no additional cost to you and will not affect the remainder of the procedure. This has already been tested on tissue samples and passed multiple safety tests. None of your allergies should pose a problem or cause any complications that I am aware of. Side effects may include tiredness, itching, and nausea. I'll remain on site for the entire duration of the anesthetic, ready to provide medical assistance and support should anything go wrong. Do you consent that I proceed? You do? Thank you so much. I assure your identity will remain anonymous, and your contribution will help our research in more ways than you can imagine. Okay. Gently now, relax and close your eyes. Open your mouth. You'll barely feel it. I practiced this several times before. And poke. There we go. Did that hurt? A little? Okay. Thank you for your honesty. Now, how are you currently feeling? Is there any discomfort or pain? None? Okay, that's perfect. We can start the procedure now. Now, this will keep your mouth open and prevent any injuries. And yes, this is the sucky thing. It'll help clear any fluids. Now, just raise your right arm for me if you feel any pain, okay? I know the dentist can be scary for many. Remember to breathe, by the way. Please do inform me if you experience any pain or odd feelings, even a little bit. It's almost done. It'll just be a bit longer. And done. You did very well. Okay, now open up. Open, please. Now bite onto this. I need you to bite hard. Good job. Now hold it still between your teeth. Okay, that's perfect. Now keep it for a few more seconds. Okay, now let me remove that for you. Okay, so how are you feeling? Are you noticing anything strange? How about some side effects? Only my beautiful eyes. Thank you. Intoxication-like symptoms, or maybe an already bold patient. Regardless, I can tell you're in no shape to return home. Let me escort you to the waiting room. There we go. These chairs are quite comfortable, yes? One of the few things we don't plan on removing. Okay, now just sit down for me. I'll be by your side until you feel better. It's refreshing to see a human come around here, you know. It's quite rare. I'm always glad to see one of your sort around here. Well, I am quite a massive individual. I tend to stand out. Scorpion part doesn't really help either. Apparently, I heard it is common for many of us who are part anthropods. Spider driders, however, are an interesting case. Some people are absolutely terrified, and others, they can love them a little bit too much. But let's not get into that. Okay, how many fingers am I holding up? Well, 16. Well, that's not physically possible. Maybe you should just sleep it off. I don't have any more patients for the day, and it's my responsibility to take care of you. You could rest on my shoulder or use the chairs. It seems the tiredness side effect is apparent here. Relax. Close your eyes. There's a good soup place not so far away from here. Smart on their side to open near a dentist. It's a bit easier on patients who have had dental work. My favorite has to be their rabbit broth, and... oh. Honestly, I'm not surprised that's what put you to sleep. Okay. Sleep now. Once you wake up, we'll have some food, my treat. Think of it as a thank you for participating in my research. Now rest well, human. And thank you for coming to our healthcare and dentistry facility.